drug addiction treatment, and the Tidal Model. The current treatment of drug addiction is good, but has room for improvement. The application of this middle-range nursing theory is not necessarily about the medical treatment, but after the patient has been medically stabilized and is no longer acutely ill. This model may be ideally applicable for someone who is chronically addicted to drugs. The Tidal Model may increase the effectiveness of treatment by offering a new way to recovery and could provide a permanent recovery in some cases. The treatment environment is deficient because, according to a study done by McElwain and others on engaging with distress and training in the compassionate approach, patients' needs are complex and highly emotional. Nurses often do not have time and resources they would wish for, and caring for patients can be emotionally exhausting and distressing. These factors are not a recipe for a healing environment and could be a stumbling block in recovery, a reason for readmission, and also a reason for why this problem is so prevalent. According to substance abuse and drug statistics found this year, there have been 700,000 drug overdose deaths in the U.S. since 2000. In 2019, there were 70,630 deaths from drug overdoses, which is over double the average per year over the past 20 years. This suggests that these deaths may be on the rise. On average, 60% of the U.S. population use drugs, alcohol, or tobacco, which can all be addictive, within the last 30 days. Substance abuse can result in dependency and addiction, high-risk behaviors, psychopathology onset, and other poor mental health outcomes. The Tidal Model is a mental health recovery model that focuses on the continuous process of change that is inherent in all people. This model uses the metaphor of water and describes how people in distress can become emotionally, physically, and spiritually shipwrecked. It says that by appreciating this metaphor, nurses or other helpers will gain a great understanding of a person's current situation and the need for change. The Tidal Model may help the caregiver guide the person back to shore and away from the storm of problems at sea. It analyzes what causes the storm and allows the patient to repair their boat and set sail again. The Tidal Model seeks to reveal the meaning of people's experiences, emphasizing the importance of their own voice and wisdom and the empowerment to lead their own recovery, rather than to be coached or ordered to by professionals. The Tidal Model incorporates recognition of the power of resourcefulness rather than focusing on problems, deficits, or weaknesses. It includes acceptance of the paradox of crisis as an opportunity, respect for the person's wishes rather than being paternalistic, and acknowledging that all goals must belong to the person. The Tidal Model may be a useful tool for patients to conquer their own demons by advocating for themselves. This may be supplementally beneficial to current practice, but if the patient is not engaged or does not understand the concepts, it may not work. Key points of the Tidal Model include the 6 philosophical assumptions and the 10 commitments. The 6 philosophical assumptions focus on recovery, change, the patient's ultimate goal for their life, resource utilization, and creative curiosity, and the 10 commitments focuses on listening to the patient, allowing them to tell their story, showing interest in that story, and using that story to organize their steps going forward. Allowing a patient to collect their thoughts and share them may help reduce their stress levels as well as their anxiety levels, and can give them a sense of hope for the rest of their life moving forward. In summation, the Tidal Model may benefit patients struggling with drug addiction because it is targeted at the psychiatric issues that are associated with drug addiction and offers a guide on how to navigate through those issues. Here are my references. Thanks for listening.